It's a real pleasure to be talking to you about the CONCEPT trial, which was a study conducted in 14 UK cancer centers. And essentially, this is a very pragmatic study because whilst there have been significant advances in the management of metastatic breast cancer, however, we do know that chemotherapy still plays an important role in the management of metastatic breast cancer. And if we look at the developments in chemotherapy, because of the significant developments that are happening in other fields of oncology, there has been a relative lack of development in chemotherapy, and probably to some extent justifiably, but clearly, given that we have not yet improve the outcomes in metastatic breast cancer to the point that we can start to say that chemotherapy is no longer required, there is a role for us to be able to develop chemotherapy options in this setting, which are not only there for improving survival, but importantly, if we cannot improve survival, improving quality of life becomes a very important parameter for these patients. In the CONCEPT trial, we compared cabazitaxel 25 milligrams given once every 3 weeks for 6 cycles to paclitaxel 80 milligrams per meter square given weekly for 18 weeks. So the same duration of treatment of 18 weeks, comparing cabazitaxel to paclitaxel. The issue here is that patients who went into this study were HER2 negative. They could be triple negative, or they could be ER positive, HER2 negative. Prior docetaxel in the neoadjuvant or adjuvant setting was allowed, but they should not have had paclitaxel chemotherapy previously. The reason paclitaxel weekly was chosen as the standard arm is because a survey was done amongst the UK breast oncologists, and the paclitaxel weekly regimen is the most favored regimen when a taxane is used in the metastatic breast cancer setting. And we also know that weekly paclitaxel is the preferred option compared to 3-weekly paclitaxel because of the study conducted previously, which had shown quality of life benefits with weekly paclitaxel. This study enrolled 158 patients, and they were randomized equally between the two arms, cabazitaxel 3-weekly and paclitaxel weekly. And the study was designed to show the superiority of cabazitaxel to weekly paclitaxel. However, the study did not show superiority, and the progression-free survival was 5.7 months for paclitaxel weekly and 6.5 months for cabazitaxel 3-weekly. It was not superior, but they gave similar PFS and overall survival results, and also time to response. What was important, however, was the difference in the side effect profile. Whilst neutropenia was more common with cabazitaxel, however, with paclitaxel, the rates of peripheral neuropathy were significantly higher, more than 2.5 times that of cabazitaxel, and also alopecia was significantly higher with paclitaxel compared to cabazitaxel. And in this study, we analyzed the quality of life based on the EQ5D and also the FACT-B subscale, and the visual analog score showed that cabazitaxel had a better quality of life compared to paclitaxel in this study. Also, in the FACT-B scale, the subset of the breast cancer scores with cabazitaxel were better than those with paclitaxel. So overall, in this study, the progression-free survival and overall survival, response rates, and time to response were similar between both cabazitaxel 3-weekly and paclitaxel weekly. But the quality of life indices favored cabazitaxel compared to weekly paclitaxel. As I mentioned before, the choice of weekly paclitaxel is essentially based on the quality of life benefits compared to the 3 weekly dosing regimens. Therefore, this study has served a very important purpose in highlighting quality of life aspects from cabazitaxel 3 weekly, and in particular in the metastatic breast cancer population where alopecia, peripheral neuropathy, and nail changes can be of significant concern to the patient's quality of life. We believe that these are important results which could offer an option of cabazitaxel 3 weekly as a treatment option when a taxane choice is being made. Importantly, in the COVID era, and as we move to the post-COVID era, we are realizing that reducing the number of hospital visits will have significant advantages both for users and also for healthcare providers. And a health economic analysis is being done on this data, but clearly a 3 weekly regimen with blood tests done prior to chemotherapy every 3 weeks would be preferable than a weekly regimen with blood tests being done prior to each chemotherapy weekly, along with the implications of the additional hospital visits. I would like to thank the participants and their carers because this study would not have been possible without their immense contribution to this study, and also the 14 UK sites which contributed to this study, and all the members of the IDMC and the TMG which enabled this study to run to its completion. And I'm really pleased to be sharing these results with you.